All right. Yvette Kidman from Perspectives. Thank you for being here. Um, so we can talk about whatever you want, but one of the things that I was interested in is you brought up emotion focused therapy. And if I understand correctly, you were practicing other forms of therapy prior to EFT, emotional focused therapy.
I've actually only been doing this about 9 years.
Oh, okay.
I went back to school at 50. This was
Okay.
like my dream, my heart dream thing,
Mm-hmm.
when I was 28, and I had gone to therapy. So I don't have just years of experience, I have years of life.
So tell me what emotion focused therapy is.
Um, Sue Johnson developed it primarily around couples,
Mm-hmm.
but they're developing more of the individual piece is now. But it's primarily working with couples and their patterns. And what I like about it is that it's not like a finger pointing thing. So it's very much our pattern we create.
Mm-hmm.
It's all based on attachment theory, which I think is the deal with everybody and everybody's problems and things is, how we were attached as a child, and so it's adult attachment in essence.
Okay.
Yeah.
So and we're talking specifically about couples, it sounds like, for this type of therapy.
Yeah, but I use it with just attuning with my peoples.
Okay.
Yeah.
So when you're first meeting a patient and what's the sort of spiel you give them about what you just said? Like you mentioned attachment and the importance of that. And then at least in the case of couples, they're not going back and forth pointing fingers at each other. So
Yeah.
can you tell me more about, uh, say more detail about what you talked about?
Okay. So when I first meet with couples, everybody has their thing that they're not happy with. And, I think the reason why I like it so much is because our emotions are that part of us, as much as our thinking, that we never really got a lot of education around or any teaching around. And it's just kind of this mystery. And so I don't think we understand that within ourselves, much less how we are being experienced by certainly our loved ones or, the clerk at the store either. But so it kind of, so I talk a little bit about that. And again, we don't really know how that, like, our emotions move us, right? And so sometimes we don't even know what's moving us. And, I- Brene Brown talks about we either move against or move away from, a lot of times when we're in high distress. And so that's sort of that pursuer withdrawer kind of pattern that gets set up in couples. And again, people aren't even aware that there's a pattern, that they can name a pattern and how it even happens, and that it's very predictable. That's
Okay.
the other thing.
Okay, so
Yeah.
let's say you have two spouses in your office, and one of them says, "Well, I know like what my emotions are. I'm angry, and I'm angry at my spouse because they did this thing that was wrong, and so what are you talking about? I don't know my emotions."
So I help them understand that, first off, like, we try and dig into that anger and find out really what's going underneath the anger, because that's a protective move. And so there's both the let's label what's going on so you can identify what your moves are, and then the real therapy comes when you can get the clients in their feelings and really work with the emotion. I mean, that's the ultimate goal you're trying to get to. So if you can label, like, when I go to anger, then I become defensive and then I blame, and so at least labeling and knowing that that's what you're doing can kind of help, take that deep breath and just pull back and pull out of it. We start with naming it, labeling the moves, and then being able to stop it in the middle of it until, you can rest and calm and then go back and talk. But it's really hard when you love somebody and you want them to love you back in your way, and they're not loving you in your way. That seems to be a big problem.
Sure. And so, in sticking with this scenario, one spouse who's angry with the other, they let's say that they agree. Okay, yes, I'm angry because I'm defensive of my person. Like I deserve to be treated better, and yep, I go to blame. And let's even say that this person agrees that that's not the healthiest move. Okay,
Right.
that's not working for our relationship. And they say, okay, well, I don't know how to regulate.
Yeah.
I feel such intense emotion. I don't know where to begin here because if I go away from my spouse, let's say, to take a break, it's not working. So how might you navigate that?
So the goal here is there's both the regulating within, and then there's the idea is that we're teaching co-regulation. And so both of those are really important in maintaining our relationships. Like if you're not going to feel close to your partner if you can't kind of lean into them a little bit and say, help me out here. Do you really care about me? Because right now it feels like you're really against me and that you don't even like me. But you're right. Like in the typical pattern, the person that's really angry is dysregulated. And so, yes, my job is to work with the angry one first.
Okay.
And get them to be more calm and to be able to understand what's really going on with them. And if I can help that person calm them, then I can bring in the withdrawer and work with the withdrawer, because actually the withdrawer is the harder person to get to open up. Because they're so wounded, and that's just their knee-jerk reaction is protection. Well, and beating you up is protection too. It's fighting.
Right.
Yeah.
So if we're starting with the angry one, what does that look like? If we could even role play if that's useful, but so getting to this idea of, okay, so there's the angry one who feels rightfully angry. And
I love that you said that, by the way. It's true. We do. When we're angry, we're so sure that we're the right one and they're the wrong one. You're so right. Okay.
Yeah.
Sorry.
Yeah. No, that's good. So, so then, okay, I say, Yvette, so, okay, tell me what to do to regulate here. What does that look like? Or what's the work? Maybe don't tell me how to regulate, but what's the work you do with somebody in that situation?
Well, to go back just another minute here is that it's important. I give the couples an attachment questionnaire, and we start with them learning how they felt loved with their parents and in their families, and how emotion was used or not used, or talked about or not talked about. Like, what did emotion look like in your family? Was there all these no talk rules around feelings, or was it just everybody went to anger and then they exploded and went away and then nothing was ever resolved? So we start with helping each person understanding that about themselves and understanding that about their partner too, because again, they're complementary and probably it's funny, I saw my husband's family, like they were so much more happy and connected and calm. But they really didn't talk about their feelings any more than my explosive, But boy, was that a rude awakening for him to come and see my father and me go at it, So all that to say is it's important to understand your own family of origin stuff and your partner's, so that you can have understanding and grace, and again, not the whole finger pointing thing. Did I answer your question?
Yeah, you did. When you see couples, is it like, I have no idea what it's like to have your job. Is there a typical scenario, like for my job, for example, with primarily medicating children for mental health issues, as an example of this scenario is they're very worried about their child, nothing has worked, and they're desperate to help their child with the mental illness that they have. Typically, the guardian of the child or the parents of the child are both motivated for the type of treatment that I offer. In your case with couples, do you typically see both are coming into your office like motivated, or is it ever the thing where like one spouse is dragging the other in? And if so, how often is that? Okay.
Oh, sure.
Okay.
A lot of times one will come and, they'll say, I can't get my partner here, kind of a thing. And sadly, it's usually the women pulling the man in, but it's not always that case, not at all, but that can be a thing. So I might try and make suggestions on how that person can, talk to their mate or partner, whatever, about how to get them there. And then it is best to meet with each one separately, because a lot of times people won't tell you what's really going on because they're afraid of offending their partner. So
Sure.
I've certainly learned the hard way that it's really important to see people without their person there.
Sure. And I'm imagining, I'm still kind of interested in this idea of, especially given that scenario, and the stereotype, which is, I'm sure, often true, which is, okay, you have the female might be interested in the heterosexual relationship of getting counseling where the male is not. I also think a stereotype that I see is the male is much more resistant and skeptical about the whole feelings thing.
Correct.
Yeah, so how do you help those men?
I try, because that's the problem, is that they've not been allowed. I mean, I could get on that soapbox because it's really not fair at all for our men in our society that have been told feelings are off limits for them unless they get angry or they can yell and scream at a game or something. So I try to assure them that this is just everybody's got a limbic system. And so some of it's psychoed, right? Like, everybody's got a limbic system. Yes, the brains come together a little differently. Again, everybody's different, but to some degree, this part is a little different. But this part, the limbic system, like, we all got it.
Yeah, sure.
So I kind of start with a little bit like, it's okay, you're normal. Like, I'm sorry that you didn't get to be sad when you were sad. And you had to suck it up, buttercup, I got that from a client. I thought it was funny.
Okay,
Suck it
got
up,
it.
buttercup.
Yeah.
No. Be mad, be sad, whatever. It's just, you're a human.
Because I think a stereotype with people outside of the psychology field is what good is it to talk about feelings? They'll have this concept of, you go to therapy and they ask you how you feel, and you're supposed to talk about emotions. And so I wonder if you can help illuminate what it is that is important about that idea of feeling emotions. Yeah.
Okay. I would love to.
Good.
So first off, our behavior is moved by our feelings and our thinking. And so a lot of, some theories go backwards. Look at the behavior, look at the thought, what was the feeling? And some people go forward. What's the feeling, what's the thought, and what's the behavior? Whatever. There's all these different theories, and it's just how you attack the problem, because it causes a problem. Especially if you're, if it moves to disconnection, one way or the other, whether you're the moving against person because you're angry, or you're moving away from stonewalling and withdrawing and punishing that way because that's all you know how to do with your feelings, that's bad too, right? So what was my question? I got off on it. Emotions, the importance of emotions. Thank you. So the reason why that's important is if you can understand that it's a feeling and it's not the truth, because our feelings feel like truth to us in the moment. And so a lot of times, if you can even, again, break it down to, okay, emotions are important. They tell us what matters to us. Like, the reason I'm so upset that you're not, being appreciative of whatever I do around the house is because I really care about you, and what you think about me matters to me. So emotions aren't good or bad, but they probably seem mystical, I think, or a mystery. And so to try and take the mystery out of them is, I think, important, and to understand that they're not always telling you the truth. You can they can really help you, but they can also hurt you. I think there are good. You got to be able. So if you don't know what you're feeling, what's the difference between guilt and shame? Well, I think of guilt as this good bad feeling, like it's meant to. It's your friend. Like it's meant to. It feels bad. Nobody likes to feel bad about what they did, but it's helping you change your behavior so you don't hurt people. On the other hand, shame says you're the bad person and you're pitiful and unlovable and nobody wants you and you're unworthy and you're just a piece of poop in the corner of the room and you just stay there. And so and the thing is, guilt and shame are all mixed up together, and a lot of times we're feeling it all at the same time. So understanding when the emotion is helping you and when it's hurting you. Because I think also a lot of times is we can be trying to avoid our feelings too. And that is just as damaging as, as living in them either. So either extreme gets you in trouble.
Sure. So, and then on the avoidance, so how can you explain, like, if someone is, maybe they have the thought, I just don't even want to go there, like it's too painful,
Yes.
It's working for me to compartmentalize.
Yes.
How is avoidance harming that person?
Well, I will tell you, a lot of people, first off, won't even come to therapy because their emotions are so scary to them. And they feel so bad. And it evokes the idea that something's wrong with me, right? And that I need help in the first place. So some people don't even, like a third of the population won't even try to come. Another third will come, but they cannot feel, they still can't, they're still not willing to go to the emotion. So then those people leave. And so we only get to keep about a third of our peoples on the planet that are even willing nowadays, because back when I was growing up, my parents, like, that was just a no-go. That was only for crazy people,
Right.
and that's bad and wrong and all that stuff. So there is less stigma now about it, but yeah. So how is it hurting people? Well, love is risky, and you can stay all safe on your little island all by yourself, but you're not going to be a very connected person. You're not going to be very happy. You're not going to feel like you matter. But we need each other. I don't care how you slice it. We need emotional support from one another. That's the connecting. When I empathize with you or somebody, that's the connection. I can, it's kind of like children when they side by side play. Well, that's like, you're going to do that the rest of your life, side by side play. Just stay in your doing mode, and
Right.
yeah, no, that's not connected. But it is risky, and it is going to hurt. You can't not love without being hurt. It's impossible. But love is both a feeling and a doing. So we just it's the both and. It's the good and the bad. It's that yin yang symbol, that black and white. They both coexist together. And so if you're not willing to feel your feelings, then you're going to be a very isolated, I don't know, not connected, lonely, miserable, sad, depressed, anxious human being.
Sure. And I suspect too that with the avoidance, I think sometimes they'll have problems in their life that they might not connect to this. If the person who says, well, this is working for me, compartmentalizing, they also, like, whatever they think their problem is, let's say it's their job is stressful, or their kids are stressful, or the marriage isn't working right, this what I've learned is that sometimes people don't see how related that is to their own lack of understanding or insight about what they're really feeling when this is the person, for example, who they're maybe at age 50 or so, they say, I don't even like this job. What have I been doing with my life? I need to get out of it. Like, they have this very late insight that dramatically changes their life because they just weren't conscious of maybe how much they hated their job, or if they were conscious of how much they hated their job, maybe lacked they lacked insight into well, maybe they're in some ways making a choice, that they have other options. Maybe they're afraid to make other options or something. But what I'm hearing you say is that if someone is, avoidance is kind of their defense, then on one hand, it's going to be very difficult for them to connect to other people, but also their life just won't be nearly as fulfilling as it would be if they're able to spend some time in that emotional area and learn about it and learn how it's affecting their life.
Yes, and what I heard you say was when they're not aware of their feelings and they're not connected to it, they're not connected to their self. They're just like on automatic pilot, so to speak. And so they wake up at age 50 and go, what the heck? What have I been doing? I'm empty. Suddenly they notice how empty or whatever, something wakes them up.
Right. Yeah. Okay. So I'm also thinking about, because I primarily work with children and adolescents, can you talk about, because most people are good, most people are well-intentioned, and so I have some very well-intentioned families that don't really know what it means or what it looks like to talk about emotions with their children or around their children. And hopefully some of what we said so far is highlighting some of the importance of why one would do that. But what does that look like? Like, if you were going to coach a parent on raising emotionally intelligent kids, what would you say?
So I didn't do it right, and I'm still fixing it with my 25 and 26-year-old. So it's never too late. I want to say that. I think why emotions are so difficult is because we're so connected to the people we love, and there's all this meaning making. See, that's another part of the therapy is it's still like, what meaning are you making when your partner does this or doesn't do that? And what meaning are you making about yourself when your partner does this or doesn't do that? So there's all this meaning making. And actually, that's why it's really hard, especially like, this is just an example from, I have one daughter with ADD. Well, although she was diagnosed with it at age 10, I didn't understand. I was busy learning about Down syndrome. I wasn't learning about ADD. And a very important part of that is the emotional dysregulation. So this is just an example of when she's dysregulated, when my kid's dysregulated and can't do it, and I come in and try all my normal kind of things I know to comfort, because I'm a great mom and I can't comfort her. Now I'm a bad mom. So then my shame goes off, and then I get big and I squish her like a bug. And so then she has low self-esteem because I just squished her like a bug and I didn't treat her like a human being who's just having a really hard time with their feelings. So that's why the parenting piece, like, that's why it's important to understand, like, how do you even get to the place where you put yours on the shelf? Like that's when it is good to compartmentalize. But that's really hard to do when you make meaning about the interaction, the parenting piece. So understanding that you're separate is really critical, and understanding what's going on with your child is really critical, and how you see it too. Like, I think about oppositional defiance disorder. I kind of hate that word. I think they're just scared to death.
Mm-hmm.
You know,
Mm-hmm.
I have a daughter with Down syndrome. She's 20-year-old, not the other two. But
Mm-hmm.
but people with Down syndrome they're just stubborn. No, she's scared.
Mm-hmm.
Her fight, flight, or freeze
Mm-hmm.
is going off. She doesn't understand very well things, and she doesn't know what to do with her body but plop to the ground or flail out, on this. But that's all she knows how to do. She's having a very natural fight or flight, freeze or please. Well, not please, but that's just going to happen because she doesn't understand that.
Mm-hmm.
So being able to stay separate and just go, okay, this is her feelings happening in her body. It doesn't have anything to do with me or what a good parent I am or what a bad parent I am. None of that. That helps me stay calm.
Mm-hmm.
And then I can tend to her
Mm-hmm.
and come over to her and say, like this morning, I'm so sorry. You really wanted that Dr. Pepper really bad, didn't you?
Mm-hmm.
And I'm sorry I lost my patience with you.
Mm-hmm.
And then it calms her. So then I can be calm when I know what she needs,
Mm-hmm.
which is just soft, gentle, calm,
Mm-hmm.
not a big, angry, impatient
Mm-hmm.
me.
Right.
Because that's just going to make it worse.
Mm-hmm.
Did I answer your question?
You are, yeah. And I think, too, the other thing I'm hearing in there is some validation, which is you're taking the let's say the trigger for your daughter, this not having the Dr. Pepper, you're taking it seriously rather than saying, you're being a baby, it's just the Dr. Pepper, for example, or, get your S together, for example.
Yeah.
Then you're taking it seriously, and it's funny because you mentioned, okay, your daughter has Downs, and and then along with that comes some more trouble, like just navigating the world intellectually and emotionally, and I don't think it really even makes a difference. Like, in other words, I could see, like, whatever you want. I really don't think anybody's neurotypical, but let's just use that word that
I
they.
agree.
Yeah.
I
Yeah.
totally agree.
Yeah.
All
Yeah.
right, keep
Yeah.
going.
Yeah. So you have, let's say, two neurotypical parents and a neurotypical teenager, and even though the behavior might look more complicated than what you just described. Okay, so for example, let's say that, you know, I'm I'm really pissed off, might say the adolescent, that you're making me do all these chores and you're on my back, and and the parent might be thinking, I'm asking you to pick up your stuff.
Right.
So they might be thinking that, okay,
Right.
but what you're describing is still the same, which is what might be more effective in the parent getting what they want, which is their child to develop this responsibility for their house, and for the parent who doesn't want their house to be a wreck, is to acknowledge, like, yeah, you are clearly angry or frustrated that you're being asked a lot, or you're really angry that that I'm asking you to do this, like,
Right.
starting there rather than the what might be typical for the family, which is, I'm not asking you to do hardly anything. We take
Right.
care of you. We do all of this other stuff. Like, I noticed that in your response too.
Yeah, it's the idea that we acknowledge their feelings and we
Mm-hmm.
don't disregard them.
Mm-hmm. You called to mind something in my life that I'd be interested to hear about what your thought is. So I have a almost 4-year-old, and then we have a 15-month-old, and so two sisters. The older sister was not interested in having a younger sister, and was jealous and all this stuff. And she's gotten a lot better. But one of the things that's hard for me is I'll hear her speaking very rudely to her younger sister. Younger
Mm-hmm.
sister, I find it adorable. She might get something to hand to our older daughter. It is like a gift, and our older daughter might be like, "No, I don't want it." And sometimes our younger daughter will cry. Sometimes she won't. And so on one hand, what comes naturally to me is like, comforting the younger daughter,
Right.
who's like, oh, she's trying to do something kind, and you know, but I also am conscious that if I if I if I don't acknowledge my older daughter's anger or frustration, then I'm harming my older daughter. And so I struggle with that sometimes, as far as how do you do both? Like, how, and I'd be interested in what you have to say about that. Like, so sometimes, for example, I might pick up my younger daughter and say, yes, it's very annoying to have a younger sister get in your space. That's probably the best that I've done. But what would you have to
That's
say?
impressive.
Yeah.
Yeah, no, that's really great because, right, because like you're in the moment, you kind of have to pick who I talk to first, and either way, you're going to be in a pickle because one of them is gonna, maybe the older one's gonna like, oh, there's dad favoring to
Right.
blah blah blah, and which sets up the whole sibling rivalry. So parenting is hard. I mean, but you're doing such a good job by just acknowledging the feelings at all and letting them know. And there's nothing wrong with coming back a little bit later and talking, because this is one of my favorite things I learned is that when we're angry, when it always, like, a lot of the couple stuff is, or with any relationships, it's, practice your listening. Well, here's the deal. Our listening is up there in executive functioning. So when you're angry, all the blood is like up there, right? Like it's actually, it's drained. I'm sorry, it's drained. And if you're angry, it's usually you're in fight if your hands, right? Or fear is more, the blood goes to your, but this is gone. Okay. So the blood is not up there. Other kinds of, hormones are happening. But that's where our hearing is. It's on this side of the brain, close to executive functioning. So you literally don't have any blood up there to help you hear. So it's not the best time to talk anyway. So that's why it's good to wait when everybody's kind of calmer and the emotions have kind of, gone back out to sea. And then you can talk maybe when your youngest one is not around, and talk to your oldest one. And I mean, that's even more meaningful than that moment. See, I do think that's the thing, is it feels like we have to take care of it because of our own anxiety, and really everything's going to be okay. Everything is almost better if you can talk later. But I do know what you mean, in that you have this urgency to fix it for both of them right there in that moment. And you're kind of stuck with, I don't want to favor one over the other, but this one is actually not being nice to that one, so what do you do?
Yeah. And then too, for myself, like, what do I do, when I'm struggling there? Like, how do I, because I want to validate the older daughter, because then otherwise it's not only the dad favors, my sister, it's also, I'm concerned about her learning that she is a rude person and she's always causing problems, and she should otherwise stuff her feelings or whatever else she might do with her feelings. Yeah. You went back to school. The intention was EFT, or is that just
No?
Okay?
No, you just sort of start trying things on. So I tried on cognitive behavior therapy. It wasn't relational enough for me. Not that I won't throw some don't talk about it, or, and throw handouts to people, but I knew I wanted to work with couples. And so then I'm kind of like, okay, do I pick Gottman or do I pick, EFT, Sue Johnson? And they have different research. Gottman's research validates all the good behaviors for couples, what they do to make them successful. Sue Johnson's research was about the actual therapy that works. Okay. And so they complement one another. They quote each other. They're bosom buddies. They love each other. They're not they're just a little different on their research. But again, I felt like the training in EFT it just made sense to me. It made a lot of sense to me. And it seemed easy and natural and something that I could certainly adapt to individuals when I'm just working with an individual as well as couples.
Sure. Okay.
Yeah.
And can you tell me about your interest in couples? Like, why were you interested in that?
We are all trying to just fix our own lives. That's all I have to say about that.
I'm so glad you said that, because I completely agree.
Yeah.
I do. Yeah.
No, marriage has been hard for us. Like, I'm so glad we made it. I'm so grateful we made it. But yeah, we're different human beings totally. And so it hasn't been easy. And so I was always just trying to fix me and the marriage so he'd like me a little bit better and figure out how to connect with somebody who's really different than me. I mean, I'm an extrovert. Everybody else in my family's an introvert. You know, right there is going to be a conflict.
Yeah. So you had your own experience in therapy, and then you clearly things got better, and is it true to say you were inspired by what happened and you got an interest? Yeah.
Yeah, absolutely. Life changing.
Yeah.
Like when you finally start to unload all this anger that you've been carrying around since you were a kid.
Yeah.
And you start to get rid of it, it's like, wow, you can stand a little taller. You're not just like, it feels freer inside.
Absolutely. And also this kind of comes back to, so I have this, I don't know if it's a bias or if it's experience or what it is, but I'm often thinking part of the reason I wanted to have a podcast like this was because I get the sense that people are highly skeptical about the effectiveness of therapy. There's massive misunderstanding about what it is and what happens. Unfortunately, there's bad therapists, and so that can cause harm because if someone tries it and they didn't get better, then that teaches them that, okay, or makes some people feel like, okay, well, the whole enterprise is just BS.
Right.
And so, or another thing is, I think some people think, well, that might help like 5% of my problems. And so I wonder if you can talk a little bit about, when you say that there's this weight lifted off, can you talk more about just as far as ways to get healthier? What I could imagine someone listening and thinking, okay, well, that's all well and good, but we are hopeless. I don't want to get a divorce, but this is hopeless. Can you talk about what can couples counseling do for that in that scenario?
So a disclaimer I have is that if you are being any kind of sexual, physical abuse, and I know that emotional abuse is just as damaging, and I'm not trying to the emotional abuse, like I think we abuse each other in our negative cycle. So there's this level of, okay, we don't treat each other well, and we just need to separate, or divorce. And is there any hope? Like, you don't want to do couples counseling if there's a certain kind of level of that can make it worse.
Sure.
That can make it worse. So understanding really the dynamics is really important. But so that said, assuming we're going with just your average, like, we're just tired of, we've just really grown apart because honestly, you've probably grown apart because you didn't know how to attach. You didn't know how to repair, to forgive, to own your part of the pie and to say, I'm sorry. Oh my gosh, is that so hard? And if that's not received, even if you do say, I'm sorry, and you've got a person who doesn't trust human beings or themselves, or they've got their own, like, I'm not worthy anyway, like, they're not going to receive or trust that apology. Like, so then you don't get a repair, and then you get all these years and years and years of just, so there's the pursuer, and then there's the burnt out pursuer, and then the withdrawer. So, where are you, how far down, like is it hopeless? Well, I wouldn't do this if I didn't believe that there was hope for every couple. I've watched people in their 70s get help. And is it going to be perfect? No, but it can be so much better. It can be so much better. So that is like, if you can't talk about your feelings, you can't forgive. That's just another thing around the whole got to be able to talk about your feelings thing.
Sure. Or like the scenario you gave where someone might not be able to receive an apology for so many reasons. And I'm really, part of the reason I love this field is because it's full of things that are counterintuitive. So I could imagine someone saying, well, I can't receive the apology because it's not sincere, or because, they've said this a million times, or whatever the case might be. And what I'm hearing you say is, well, okay, not necessarily disagreeing with that, but there could be a lot more underneath that's not directly related to your partner that would be the reason that you can't accept an apology. And people might not be aware of that.
Correct.
Yeah. Okay.
Yeah, and there is, people do think there is an idea out there that, some people have just been hurt too, and there's just too far gone, that there's no way back. That's not for me to decide. I don't decide that for anyone. That's for them to decide. But I'm gonna fight for that relationship, and I'm gonna care and believe that they can change if they want to change bad enough. But you gotta want it. You gotta be willing to do the work. You gotta read the books. You gotta, you can't just show up at therapy and show like that means something. Some people won't even do that, but so that means something that they care about the relationship. But you got to do more than just come to therapy. You got to actually start to implement the things that the movements, right? Like I'm always trying to set up a vulnerable an enactment is the term, and a moment of vulnerability between people, and that's the goal. That's the gist of, after you understand your, identify your cycle, and the goal really is in every session is to find a moment that I can set up where they can have a face-to-face moment of vulnerability.
Because what does that do for a couple?
That connects them. That's the connection. When you can get into your vulnerability, now you're bonding. Like you're receiving it, you're hearing it, you're responding with kindness or empathy or understanding or compassion. Those good feelings. Like we're trying to calm the bad feelings, understand what's going on underneath the bad feelings, and find that good feeling, that love, that compassion, that kindness, that can kind of mend, kind of heal those wounds.
Yeah. So you have a couple who presumably was in love with each other in the beginning, and then you are encouraging or setting up or otherwise scenarios where a couple who might have like grown apart, using air quotes, then they have an experience where they're being very vulnerable, very uncomfortable about some issue that they have or that they perceive in the relationship, and then presumably you're coaching the other person, if they're not doing it already in that moment, how like the significance of that they're doing that in front of the other spouse, and then also like how to respond in a way that connects them.
Right.
Okay. And
sometimes I try to help them do that, or notice when they did just have a moment. I had a couple that's last week, and they had a moment that was really great, and they didn't even know that it was a good moment.
Okay.
It was just a moment. She was talking about some stuff, and she kind of turned to him and said something, like, yeah, you remember, blah, blah. And he goes, yeah, he agreed with her, right? Like, he agreed, yeah, you're right. That was, you're right. It was that way, or whatever it was. And so I just stopped her and I said, look what y'all just did right there. And then I like expanded on that because they just need more of those. Those like agreements and hearing and like, look, you can do that.
Yeah.
So sometimes it's just that.
Yeah.
They don't even see they got some good stuff going on here.
Yeah. You call into mind with kids this phrase, catch them being good.
Yes.
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 Because that might be underneath our consciousness as well. Like the things that are going really well that we might otherwise miss because whatever reason we're stressed or otherwise. Yeah. So one of the things I'm actually working on writing something for parents who had a lot of questions. There was a lot of questions from the survey I had people fill out about what types of things would they like to learn about, and the most common one was how to manage challenging behaviors. And essentially what I'm starting with is I really think it's helpful if parents are really dealing with whatever challenging behavior means for them, getting their own therapy. In my experience, that's something that people really neglect because of stigma, false impressions of what therapy is, maybe bad experience with therapy. And another thing I think, though, is that so, okay, in an ideal world, people would be getting individual, and I think it'd be good for couples to get their couples too. But I thought sometimes that even just getting couples, which again might not sound intuitive, but first of all, kids that have really challenging behaviors or stressful, they are seemingly almost always going to impact the marriage, in my experience. Yeah. And so it seems like at a minimum, because we have limited time, limited resources, if parents would agree to at least go to couples counseling, even if there's nothing overtly wrong with the marriage, sometimes it seems like that's another way to go, because the child can affect their relationship. And I wonder what your thoughts are about that, like the idea of do you think that one is definitely better than the other in the case of having a child with challenging behaviors? What are your thoughts?
Okay, so I just love that you said that because I would say that Jenna, my daughter with Down syndrome, that was like, that was definitely not that we had all the best communication up to that point, but yeah, that made the last 20 years really difficult because the divorce rate, the fact that we're still married is incredible, honestly, because that does create so much stress, like unbelievable, because that child's behavior just gave off all kinds of, negative energy, I'm going to use that term, in the environment. It created chaos because now that stuff gets inside each person, right? And which then that feeling that gets inside of my husband or me, I'm going to react differently. Than he is. I might move against him. I'm really good at blaming the poor guy. Like, that's kind of like, that was my family. We just blamed. We just blame. And that was not helpful. And so, yes, I absolutely agree with you. When we got our dog, the dog trainer said, you and your spouse need to be in agreement, and the kids too, to train this dog. Y'all need to be all on the same page. And if you have not, you need to go to family counseling.
Wow.
So if she's going to say that about a puppy dog, then can you imagine how much more important it would be to get a couple to be able to talk about what happens inside of them when the kid is lacking boundaries, dysregulated, difficult. I mean, I realize there's some kids just are even kind of mean and hateful and say awful, awful things and do awful, awful things, and yeah, definitely. I think that's to get on the same page. That's really hard to do.
Yeah. Yeah, boy, your dog trainer sounds super progressive and awesome.
I know, I loved it.
Yeah.
I thought if she's going to say this about a puppy, oh my goodness.
Yeah. Another thing I like that you said that I continue to run into in this field is parents. I think that every parent at some point, or I should say this, it would be very, very normal for any parent, no matter how good of a person you are, and even no matter really how great your kid is, to at some point really dislike your kid or even have the feeling of hate for your child. And it is completely understandable, I think, clearly from your perspective and mine,
Yeah.
that they can cause behaviors that are really hard, challenging, or even damaging to the family. And I think some parents, even those words, they don't know they don't know that the circadian feelings or thoughts to have to begin with.
Yes.
Yeah, and they'll say things like after some amount of time and comfort is built, so they'll say, I hate to say this, or I feel bad for saying this or something like that. And they're always good parents,
Right,
it's very clear without them having to justify, like, I know you love your kid, I know you care about your kid, but even just acknowledging that, I think, is super helpful and important, because then
Right.
too, it highlights that you're not just being weak or a bad parent if you have those, and it is really challenging, and all the more reason that you would benefit from taking care of your mind, such as through therapy or couples.
Absolutely.
Yeah.
Yeah, absolutely. I like the term emoting. When you can't help but have some thoughts and feelings go off when your kid's behaving like you would be a saint or God or something supernatural. A robot, I like that one. A robot, something, whatever your belief system is. You would not be a human being to not be affected by their really terrible, awful behavior and all of that. So to find out, to understand that it doesn't mean you don't love or care about your child, but yes, you're going to have a negative, like they just challenge you. They just right? Like you understand that, like, if you can even call it emoting, like, let me go whine and complain in the basement and let off some steam about something I don't really mean. I don't really mean
Yeah.
the thoughts I'm having,
Right.
as much as they're really generated from some bad feelings that really just need to just be regurgitated out of my body.
Right. And thinking back to having the awareness of emotions, which I also think a benefit of therapy is, you get really comfortable with emotions that might have previously been painful or shameful. And so, but if you can't even admit to yourself that you're having these thoughts or emotions, you can just become, like, your mental health can really get worse. Like, if you can't even, because even to get to the basement to do that, you have to be aware that you're having the emotions and you're having the thoughts, and feel comfortable enough to go and vent to your spouse or whoever.
Right.
Yeah. Okay.
Yeah, definitely important. And it could make such a long term, like, change the trajectory of your children's lives if you go get couples help or individual help. Like it's generations that you're changing by doing your inner work.
That's right. Yeah. And also, I think that from couples counseling, people can learn, like when they're working on their relationship with their partner, a lot of that really translates to raising healthy kids. You know, some of the skills you do, or the vulnerability that you were talking about. I could imagine there being many places where, for a different reason, parents feeling comfortable being vulnerable around their child would help that child develop emotional health. Like, for example, becoming more comfortable with feeling guilt or noticing shame. You might be able to relate to your child better. You might not be so quick to fix it for them, having had the experience yourself that you need to not be fixed in that moment. And then two, like, as you said, if in couples you're bringing your own attachment issues to that, well, that's no different than with kids, right? And so if
Right.
you're learning those skills, then a lot of them translate.
Absolutely. They absolutely translate.
Yeah, yeah. This is completely off topic, okay? But I wonder, I'm interested to hear about, completely off topic, what your thoughts are about medication. And I'll give you one example. You might have heard of benzodiazepines like Xanax or Ativan. These are things that help relieve anxiety, among other things.
Right.
So those are meant to be prescribed short term. Many people are on them their whole lives. It's not how that's intended to be used. And then there's like what one might call an anti-anxiety, like an SSRI, which is not addictive. You might be on it your whole life, and you might not. It's whatever's helpful. I had one. So I've definitely worked with therapists who, benzos, especially like in trauma work, for example, no good, because then the person is not really having to sit with the uncomfortable emotions or anxiety. So, and especially in the case of trauma work, I know that benzos are a no-go, whereas SSRIs are okay. But I've also worked with a therapist who was doing some anxiety work for a very anxious patient and was not wanting an SSRI prescribed. She thought that would be damaging to therapy in a way like these harder benzos that just suck the anxiety right out could be damaging. And I'm just interested to hear in your experience, like what do you have to say about medications or experience with prescribers?
So one of my greatest regrets is not putting my daughter on the ADHD meds. Wow, would I do that one over? But I didn't, and she's now, put herself on it, and she's having a better life.
Okay.
Glory, hallelujah.
Okay.
But specific to like what you were talking about, trauma, I think that the medication is meant to help you get into the feelings, so that you can start to think about things differently, as well as to feel what you need to feel. So that's where you are the expert, and I don't know if I'm ignorant in that area. But I definitely recommend with clients, you need help, get help. Like, it will help us, like, kind of like, if you're a horse and buggy and you've got a cart behind you. I think what you're saying is certain medications are meant to kind of help you start to carry the cart, pull the cart, so you can start to unload the rocks that are in it, is kind of the metaphor I would use. But you're right, if you're on some medication that is completely numbing you and you can't access any of those, then no, it's probably not helpful. But that's why you're the expert, Jordan.
Yeah, I hear that too from therapists, and I actually just made a blog post about this because I think that therapists are much more knowledgeable than they might feel. I like the humility, but you guys see the patients much more often. You see what patients look like before and after being prescribed certain meds. And then also, like, if this patient doesn't have a prescriber, you're kind of in the important seat of, okay, whether or not you're thinking of it this way or not, but at some point you're deciding, okay, is this something that I should recommend them even seeing somebody about? So, apparently in this therapist I mentioned, in their experience, they must have had an experience where for their anxiety work, SSRIs were not helpful. And so I'm always interested to know, like, what therapists' relationship with meds and prescribers is like, because it's a different field. And yeah, so I might be the expert on what thing might be best to be prescribed or how the medication works, but there's an interesting, like, the way our healthcare system is set up is bizarre. And so in this scenario, it's very weird that a psych prescriber would see the kid or the adult like once every 3 months as a standard of care if they're doing well. But you see them in an office for like maybe a half an hour, and then the therapist is seeing them every week for 45 minutes to an hour. And so it just seems strange to me, the concept of prescribing as though I know, like our training is in how meds work, and then given the medical and psychiatric history, what might work best. But there's this big gap, like similar to, I wish I could go into all my family's homes. Like, if I was really going to do a good job, get to know them in that way and see how things really play out, rather than just get a report in my office, for example. So
Right.
that's why I was curious.
Well, I think the law, ultimately it would be optimal if you get them to the point with their health, with their mental health, that they don't need the medication. On the other hand, some bodies just aren't going to produce dopamine, or they just aren't going to produce the thing that they need. Like with alexithymia, dysthymia. I'm sorry, I totally got those confused. Some people just, their bodies are never going to produce it. But we'd like to think that with therapy we can actually help people get off medication.
Sure.
Eventually.
Sure. Yeah, and I agree completely. I think that the reason I mentioned for some people on it for a lifetime is because there are situations where bipolar is a great example.
Yeah, you just don't know. You just don't know the individual. So some bodies actually do need it forever. But like, I've worked with a man for, I don't know, he's one of my first clients, and we laugh all the time. He came to me about career counseling. That's not what he needed, and so we worked for several years and we got him off of the depression, but here comes the anxiety. And so we got him off his depression meds, worked with the anxiety, he would have to try, start to test to see if he can go without the anxiety. But he definitely has all the tools and the thinking, and he, you know what I'm trying to say? Like,
yeah, he was able to learn skills that I think about the brain, and I think about, if you're one way or another, you're changing the brain, whether it's with meds or with therapy, you're strengthening some connections or making new ones, or you're weakening others. And so if that's the way that's working for him and he doesn't need the meds, then that's great. Like, if he's learning how to make those connections, or he's his brain is doing it for him with his behavior, then that makes total sense. Yeah.
So it was just, I've been learning, he has a huge trauma, but when you lift one thing, you find another thing, and the medication had to, it just had to be taken care of through someone like you.
Right. Okay. Yeah. Sure. Yeah. You made me think of something else too that I run into, and this is not a slam at parents, but it's interesting to see. I'll see sick kids who are very rightfully getting med management and therapy, but a lot of times parents If I ask if they're getting any kind of help, they might say that they're medicated, but there's no therapy. So I I think
Ouch.
I think it's extremely rare that the meds alone are enough. There are cases where it is, but it's interesting that they fully are on board with their child because they love their child, but for them, their sort of mental health isn't even really considered more than okay. I'm getting medication.
Right.
Yeah, yeah, yeah.
Yeah, you need both
Yeah.
in most cases.
Yeah, yeah. I think at least the ones I see, because I'm a non-random sample. By the time someone's seeing me, it's like they've been through quite a bit. So yeah,
Yeah.
yeah. Can I ask? It's a personal question, but what can you say more about wishing that you had started ADHD medication sooner? What were your concerns at the time? I'm interested in that.
Um, Absolutely. So we took Emmy. Her teacher said, I think you might want to evaluate her for ADD. Back then it was you either had ADD or you had ADHD.
Sure.
Now it's all under ADHD. But anyway, she had the attention deficit piece of it. And, we went and took her and she was evaluated, and yes, they agreed. And she was kind of on a little bit of the border. And again, she's really smart. She had this super IQ. Like, she did all that testing. And so they said, well, here's a sample. And so I got the sample. And then I went and talked to my husband about it. And this is not blaming him either. He went and consulted with his brother, who is a physician, who said, well, this has a little bit of an addictive component to it. Have her go back and ask the doctor to try a different one that wasn't didn't have that, can't think of the right word.
Sure. Addictive risk or whatever.
Yeah.
Yeah.
And I was busy, overwhelmed, and my own shame of not wanting to offend the doctors stopped us. Not my husband, not my brother-in-law, me, because I didn't want to just go back and explore, because I didn't want to offend, our doctor. And she would have probably been so fine about it if I had just inquired, And so then I just didn't, because that's who I was back then.
Sure.
It's not who I am now. And
Sure.
now I would just ask, well, okay, so we've got this concern. Can you tell me more about it? What do you think? I just totally dropped the ball.
Sure.
So, and I regret that. I regret it because, this is the last thing I'll say, is that how not being on the medication affected her sense of self, her self-esteem. She always felt like the odd one, and that she didn't belong in her school or with her group of people, and she's figuring all that out now, but yeah, I just really, really regret that, because life didn't have to be so hard for her. Yeah, you're right. She would have needed a therapist as well as the medication, and not just the medication.
Yeah.
So I do regret that.
I'm so glad that you shared that, because the reason I asked is not just because I'm curious, but this is many, 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 many parents, and so it's helpful to know that. And I think that whatever the reason is that a parent might feel that they might offend the provider, whether it's, you mentioned some of your own stuff or otherwise, I think it's so important that that people feel empowered to do that. And so now I'm seeing these parents who are listening, not you, because because if you can't, if you're worried about offending your provider, I would highly recommend testing that. And if the provider is offended, that is a red flag. People should feel absolutely comfortable challenging the provider, questioning what they're doing and why they're doing it, asking whatever questions that they want. And I'm saying that because you called this to mind, that I see it very often. I have friends who or siblings who have this sort of thing, and it's something really important. And then too, we've talked a little bit about before we got on the air, some places that don't treat patients so well, and so there are also providers that would be offended, or mistreat the patient or be condescending or something, and that's a really, really, really not okay.
Right.
Yeah. Yeah.
Right.
So appreciate you sharing that, because that's, yeah.
But see, that was my feelings, right?
Mm-hmm.
Those were my feelings that got in the way.
Mm-hmm.
My shame or my fear of rejection or whatever it was. But like, and that hurt my child. And that's the part I really regret.
Yeah. 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 I already have mine. Mine are still 1 and 4, or
Ooh,
almost
yay.
4. Yeah. Yeah. Yeah.
Yeah.
Yeah. But the regret that, you just, I appreciate more than ever that, parents are just doing the very best they can.
Absolutely.
Yeah.
And I did the best I could. And
Yeah.
I'm just grateful I have a relationship with my girls. And
Yeah.
we just talk about it now.
Yeah,
So
that's
it's,
nice.
again, it's never too late. They're doing their work, and
Yeah, good. That's
Yeah.
great. Okay, well, anything else you want to add, or you wish parents or patients knew, or public, about anything you do, or misconceptions that people might have?
I think you did a great job of making like saying a lot of good things. Like,
Oh.
we're not all perfect. We do make mistakes, but if one of us hurts you or doesn't do it right, then go find somebody else, right? Just stay with it.
That's right.
There are good people out there. I've had to apologize to some of my clients, and all that does is, like, that gives us a chance for them to experience what a real repair can feel like. And I mean, it's not fun, but
Yeah, agreed. And I make mistakes all the time. So yeah, I think that's a good thing, and hopefully patients too take away that, yeah, we're human too, and we care about them if we care about repairing that if we make a mistake, and then hopefully builds trust too, that we're not going to just cover ourselves.
Right.
Yeah.
Yeah.
Yeah. Yeah. Thank you so much for doing this. I really appreciate it. I know it will be helpful to the people that listen to it.
well, thank you for asking. It's been so nice to have some time with you.
Thank you, Yvette. Okay. Good to see you.
Yeah, thanks. Bye-bye.